All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So today we'll continue with our discussion with the anti-androgens that may be used for COVID. So this is another study from Brazil. Yesterday's study that we discussed the drug that was proxalutamide, and that was for hospitalized patients. Here, the drug that we are going to discuss today is dutasteride, and this is for the mild COVID cases. Dutasteride is also part of the FLCCC protocol as well. So let's very quickly look at the references, and then we'll start looking at the illustrations. So here goes the references. Again, I'm working with the OBS, so please forgive me if anything breaks. So this is drbeen.com. Of course, my own picture is on top of the links. This is the study here. The study was published in Feb 2021. Early androgen therapy, anti-androgen therapy with dutasteride reduces viral shedding, inflammatory responses, and time to remission in males with COVID-19. And the type of the study is important here. And then I think that you have seen FLCCC and the IMAS plus protocol, IMATH plus protocol. So if you see here in this protocol, you will see, let me just, so nitazoxanide was also used in this study that I would show you. And here, if you see spironolactone and dutasteride here, this is the drug that we're going to talk about and the study that we're going to talk about. So now let's start with our discussion. Okay, so back to our illustrations. So once again, my apologies if it does weird things. I am still learning to work. This is Photoshop. So continuing, why this study? So the study today is, the basic purpose was, can anti-androgen therapy help manage mild COVID? That was the study. And the objectives for the discussion today are that we'll review the study and we'll look at the mechanism. So mechanism for dutasteride is slightly different from proxalutamide. So we will look at this mechanism today. We actually did this mechanism before as well. So here in one cartoon, if you wanted to see the whole action of the whole study's mechanism, that is here. So here is the mechanism. Let me make sure I can. So we know that in prostate, we have an enzyme called 5-alpha reductase. The function of 5-alpha reductase is to take testosterone, which was made by the Leydig cells in testis. 5-alpha reductase takes testosterone and converts it to dihydrotestosterone. So if you see here, there is testosterone all chest out, all proud, and it has two hydros with it, two waters with it. So dihydrotestosterone is the conversion. This dihydrotestosterone is much more potent compared to steroids, or compared to, I shouldn't say steroid, compared to testosterone. So the basic mechanism of action of the drug that we're talking about, dutasteride, that is here, what it does is that it tells the 5-alpha reductase to stop doing this, or in general, it disrupts the 5-alpha reductase enzyme and it blocks it from converting testosterone to dihydrotestosterone, which has two effects. Number one, dihydrotestosterone is reduced. Number two, testosterone is increased, and testosterone would then have a negative feedback on the system of this hypothalamic hypophyseal axis for gonadotropic hormones, and it would give negative feedback and reduce the production of androgens as well. So this is the basic mechanism. So rationale for this study, they also have a similar rationale as we saw yesterday, and that is that men have more severe cases compared to women, number one. Number two, women with hypogonadism also have a higher severity compared to, or more intense severity of COVID-19 compared to women with healthy genitalia and gonads. So again, I saw some comments yesterday that obese folks, and so here we are looking at this study. They made a conjecture, then they went ahead and they said, let's see if we can prove this. Let's see if it works. Now, would it be just a fluke? Maybe. But the data that we have and the study size that we have and the p-values that we have, they're all significant. So I think this data is correct. Continuing. So androgens are an important difference between women and men, or the amount of androgens. So this study, if you see here, the study size is that there were 130 people. So again, small study, 66 in the placebo group. Now, all of the patients, regardless of being placebo or not, the standard of the care that they were doing was they were administering nitazoxanide plus azithromycin. That was a standard of care management for COVID in this facility, in this hospital. So I believe nitazoxanide 500 milligram twice daily and azithromycin 500 milligram once daily. That was the standard of care. And that is what was given to the intervention group as well, or the group that was receiving the new test drug. The drug itself is not new, but new for COVID. And that is dutasteride. Dutasteride was given 0.5 milligram once daily for 30 days. Now, up front, of course, many of us would be thinking, especially men, that, hey, there will be side effects and the impotence and the sexual desire and libido and sperm count and all of those things may be an issue. So interestingly, number one, it is written in the pharmacology books that when these drugs, 5-alpha reductase inhibitors, when these drugs are stopped, right away, the normal effect of androgens resume. So for example, if somebody has prostate cancer and they've been using 5-alpha reductase drugs, as soon as they stop it, the prostate starts growing again. So even if there is any adverse effect on sexual performance, that is temporary and as long as the drug is used. And of course, in the case of COVID management, drug is not to be used forever. So that is one. Secondly, the adverse effects that they actually saw were, if I can very quickly go to this and then give me 1 second. I want to read them out for you. So diarrhea and nausea. So let me just very quickly. These studies are good homework. So here, of the 44 patients from the placebo group and 43 patients from the dutasteride group. So you just saw that 66 and 64 is what I have written. Here, finally, the patients who were participating were 64 and 64, 66 and 64, but the one who were analyzed were 44 and 43. So if you see here, from the dutasteride group, so of the 44 patients from the placebo group and 43 patients from the dutasteride group, 17 and 14 reported at least one adverse effect. So both groups had adverse effects. That means the remaining drugs, nitazoxanide plus azithromycin plus generally the disease itself, that also had some things which caused side effects. Again, this is mild cases. Except for changes in urine or sperm color, I would replace sperm with the semen color over here, or aspect due to nitazoxanide use. This looks like Google Translate, but what they're saying is nitazoxanide use causes discoloration of urine and semen. All adverse effects fell under grade 1 and 2, and no serious adverse effects were reported. Moreover, none of the patients had to interrupt treatment due to adverse effects. The most common adverse effects were diarrhea, 12 and 11. So 12 in the treatment group and 11 in the placebo group. And nausea, 7 and 6. 7 in the intervention group and 6 in the placebo group. No hospitalization, mechanical ventilation, or deaths were reported. So I wanted to make sure that right up front, we can think about the, what is that? The side effects. So going back to the illustrations, still learning how to use OBS more effectively. So here, so this was the intervention, 66 people in the placebo group, 43 were finally analyzed, 64 in the intervention group, 44 were analyzed. Then study type. So as we saw yesterday, this is actually also a good study. Prospective, interventional, of course, there was a new intervention, and that was dutasteride. Placebo controlled, the other group was getting a placebo, randomized, double blind, and I did not know if they were quadruple masked or not. I would suspect they were, because that is just normal for the studies, but I do not know. They do not mention it. Now, the study goals, what were they trying to do? So again, this is mild cases of COVID. So here is what they were trying to figure out. Number one, will people on dutasteride remit faster, or will their viral load reduce faster? That is one goal. Second goal was, will their oxygen levels stay better and not deteriorate or improve? So that was a second goal. Third goal was, will the RT-PCR become negative faster than the placebo group? Fourth goal was, what about the labs? So for example, C-reactive protein, D-dimers, lactates, LDH, ESR, troponin, ferritin, some of them are for inflammation, some of them are for liver toxicity, and so on. What about the labs as well? So these were the 4 things that they wanted to see. The conclusion, I would spill the beans here. So if you just wanted to see the summary, after this conclusion, you can actually disengage and say, we're done. And I would continue to go in the details afterwards. The conclusion of the study was the following. The findings from the study suggest that in males with mild COVID-19 symptoms, undergoing early, so males, not women, males, mild COVID-19, undergoing early therapy with nitazoxanide and azithromycin. So please realize that whenever we are doing a study, with whatever set of medicines are being used, they all become applicable as a result of success of the study. So if the study is using nitazoxanide, azithromycin, and dutasteride, and the study becomes successful, then we cannot say that drop nitazoxanide and let's say azithromycin and only use dutasteride. Then all these 3 are the combined intervention. This is why they say it over here, that nitazoxanide and azithromycin treatment. So these are the men who are already under this treatment. And if you add with them dutasteride, then the viral shedding is reduced, inflammatory markers are reduced compared to the placebo. So this is very important, that, and I would show you the results, that the viral shedding is reduced significantly, inflammatory markers are reduced significantly, patient recovers faster than others. So this is it. This is the study's conclusion. It proved that dutasteride works as well. Yesterday we saw a study that showed proxalutamide works as well. This is why antiandrogens in men are useful for helping during the management of COVID. Okay, so now we're going to continue with some more detail. So here are some of the study results. Study results are actually, they've done a very good job with the results. So let me go to the results fast. So if I show you the results. So if you see here, clinical outcomes, they have them, all of those over here. For example, look at this. Time to remission days, fatigue, 10.3 days in placebo group and 5.5 days in dutasteride group. And p-value, look at the p-value, 0.001, significant. Loss of taste or smell, anosmia, which has become very, very common nowadays. So anosmia, number of days, 11.1 in placebo and 5.6 in intervention or the dutasteride group. Remission minus taste or smell loss, 11.7 and 7. And keep an eye on the p-values as well. Overall symptoms, 16.3 days versus 9.2. P-value is significant. Clinical recovery, and that is fully clinically recovered on day number 7. 57.5% in placebo, day 7 fully recovered, and 84.1% in the dutasteride group. And look at the p-value, that is also good value, p 0.03. Percent of clinical recovery on day 1. So again, I would leave the day 1. Day 7 is interesting. Oxygen saturation, day 0, 95, 96. But if you see once again, day 7 over here, plus 0.3, plus 1.3. So whatever was the saturation, there was a plus 1.3 improvement in it, the percentage. So if it was 94, let's say it became 95.3 and so on. So p-value is significant here as well. So good results. And then if you look at the labs, the markers. So here are the biochemical labs. So if you see RT-PCR and cycle threshold is greater than 40 for remission. So dutasteride, and here day 0 is 0. But if you look at day 7, 11.8% were in remission versus 64.3% were in remission. So viral load by 7th day was significantly reduced. P-value is 0.009 instead of 0.005. I think it is 0.05 that is important. So this is good. Day 14, 54.3 and 88.3. Then look at CRP, C-reactive protein, which is the acute phase protein. As a result of inflammation, liver produces that. And again, I'm going to go to day 7, 1.47, 0.34. So it is reduced and p-value is significant. Lactate, day 7, 2.66, reduced to 2.01, 0.0049 p-value. Lactate increase, and so on. I would let you see this. The point they are making here is labs improved, clinical outcomes improved, viral load reduced, and they were all significant. So going back here to the discussion, this going to the OBS and switching to various screens is slightly interrupting. Anyway, so here we are. One second, I'll go back here. So I just took a few of the parameters from there. This is the intervention column, and this is the placebo column. So if you see here, clinical improvement, reduced fatigue, anosmia, and overall disease progress was better on the intervention side. P-value is significant. Day 7, high viral load or remission, high remission, was 64.3% versus 11.8%. I think some of the translation causes this issue. What they're saying here is that on day 7, viral load was reduced significantly. So 64.3% people had reduced viral load versus 11.8%. Better clinical recovery in 84.7% people versus 57.5%. High oxygen saturation or oxygen saturation improved or stayed high, 97% on the intervention side and 95.7% on the other side. So this was some of the interesting study results. Now going to the mechanism. So we saw this yesterday. I am once again repeating it here for the completion's sake. And of course, today we're talking about dutasteride, so that mechanism is different. We saw that before as well. So here, the important thing to understand that for androgens, the basic concept why they are useful is that androgens are more in men, that is understood, and androgens are also the ones that trigger the production of TMPRSS2. We also know that TMPRSS2 in turn are used by the SARS-CoV-2 to prime its spike protein and allow it to fuse with our cells. Similarly, the androgens are also responsible for higher density or higher number of ACE2 enzyme in men. So those things are useful for the virus and they're counterproductive for us. So temporarily reducing the androgens are actually helpful. So that is the basic gist of the mechanism. Now, this is also something we saw yesterday, that what androgens do, I keep struggling with the Photoshop layers. What androgens do is that androgens bind with the androgen response element, which is the receptor on the genetic or the DNA for TMPRSS2, which would then cause TMPRSS2 to be increased, which will then contribute towards the severe disease. Then here is the different mechanism compared to yesterday's discussion. Here we have testis. He looks a little wicked. I don't know why. I was trying to test a new expression. So here is testis. Testis is making testosterone. And remember that it is making testosterone under the influence of luteinizing hormone, which is coming from the pituitary. And pituitary is making luteinizing hormone on the orders of the hypothalamus. So gonadotropic releasing hormone, and hypothalamus is asking this to be done, number one, for a normal biological actions, and secondly, on the psychological state of a man as well. The end result is we have testosterone. Testosterone would go to prostate. In the prostate, there is 5-alpha reductase enzyme that would reduce testosterone and add water to it. And so what will happen is this will become dihydrotestosterone, which is much, much more potent and active. And that is where the TMPRSS2 increases. That is where the severity increases. So here is my first attempt to express how dutasteride works. So dutasteride tells the 5-alpha reductase to stop doing its function. So when 5-alpha reductase is reduced its function, that causes less dihydrotestosterone to be produced. That causes, in theory, less TMPRSS2 and ACE2 to be produced. And that is helpful. Now, once again, let's say that reduction is so drastic that pro-inflammation and anti-inflammatory responses become too out of balance, then we'll have a side effect of the drug. So what they have done is they've given in a dose which they thought was correct, and then they saw the results. And in those doses, in those profile of the men, it actually worked out. So let me very quickly show you the population's profile as well. So 1 second, I have to go to OBS to correct the structure here. Okay, so the population profile. Apologies. There is a table, I know, that shows the profile of the people. So if I can't find it, I won't waste your time, and I'll just have you look into it. So over here somewhere, study design, potential, study population, and I think down here is the profile. Results. Here, characteristics of the study population. This is table number 1. So if you see here in this population, age 43.8 and 40. So that was the age range. BMI is given 26.1, 26. Time to treat 4.4 days, 4.3. That is before the drug was given. Comorbidities, obesity, 4 people here, 5 people there, so very comparable. Hypertension, 12 in the placebo and 7 on the other side, not very comparable. There is a difference, 15.9% versus 27.9%. MI, nothing. Stroke, nothing. Congestive heart failure, nothing. Lipid disorders, 9 and 9. Other cardiac dysfunction, 0 and 1 on the intervention side. Type 1 and type 2 diabetes, 4 and 4. Pre-diabetes, 8 and 5. Dysglycemia, 12 and 9. So if you see here, it is interesting that they have given the study population characteristics as well. Insomnia, 4 and 1. Hypothyroidism, 1 and 4 on the intervention side. Autoimmune disorders, 1 and 1. Erectile dysfunction, already 2 and 1. Hypogonadism, 8 and 8, and so on. So you can check that out. But these are the study populations. Let's now go back to the screen sharing. So here, this is the mechanism, and then finally this cartoon, and that is where we'll stop. So here is what would happen. Dutasteride would ask the 5-alpha reductase in the prostate to reduce its function to convert testosterone to dihydrotestosterone, which would reduce a potent androgenic hormone, which would in theory reduce the TMPRSS2 numbers and ACE2 enzyme. And at the end, I would repeat, as soon as the drug is stopped, this drug was given for 30 days in this study. As soon as the drug is stopped, these effects will become reversed. So it's not a permanent damage. I would think that during this time, it is possible that there is some change in sexual behavior of the person. So Barbara says, oh my God, goodness, this is a cute cartoon again. Thank you very much. I spent some time, although I'm still not happy with the cartoon because the color scheme is still not the best. But I only have so much time during the day to work on this one. Today I was especially busy once again because somebody today again made a complaint and started an audit on us, and the auditors were looking for documents and they were communicating. So I was working with my team. So with this, please do me a favor. Please like, subscribe, and share. I saw Billy Block saying reversible, thank God. Yes. So please like, subscribe, and share. And if you would like to support this work, there are some links in the description. You can buy me a coffee, which does not need PayPal, or you can use PayPal, or you can be a patron. With all of this, thank you very much for your time. I'm going to come back in a few minutes for a quick chit chat. Carolyn, what happened? I see an angry emoji. So thank you very much. I would see you soon.